Amid growing COVID-19 cases, what can we expect from health officials in the next administration? Joining us now is Health Spokesperson Rosario Vergeire, who is taking on a new role as Incident Manager of the National Vaccination Operations Center. Good evening to you, Yusek.
Good evening, ma'am, and good evening to all of you.
You will be taking over as NVOC Chair, Health Undersecretary Mirna Cabotaje, starting tomorrow as Incident Manager. What's our situation now, and what would be your target vaccination for the rest of 2022?
Yes, no, so our situation right now, we have already vaccinated about 70.5 million Filipinos. And this is about, we've reached that 70% target already that we are aiming for the end of this administration. Just a little bit less of the target that we wanted, but at least we've reached that 70 million. What we are expecting right now and what we are planning to do would be to reach about 80% of the total population by the end of the year. And this would be around 88 million. We are trying to analyze the data right now and trying to look at the different issues that we are having, because we have to understand that all of our areas in the country will have different contexts and settings. So we are trying to strategize based on the setting of each of our regions, and also looking at the different nudges that we need to do for the different sectors that we are vaccinating, like the children, the adults, and the senior citizens.
You mentioned that there are different situations for different areas, but right now, which areas have the lowest inoculation turnout, and what are the main reasons behind that?
Well, right now, we all know, and we had reported this already, BARM would have the lowest among all of the regions, and we know the different factors affecting BARM. It would be the accessibility also of the vaccination sites because of a lot of factors. And also, it's really hard for us to transport our vaccines going to BARM, and also the storage capacity of BARM. But we have tried to provide assistance for these past months, and we are trying to focus on this area so that we can be able to improve the coverage in BARM.
And as incoming NVOC Incident Manager, do you have any new plans to increase the vaccination rate in those areas?
Of course, that was what we are planning to do, that we are going to put some more efforts and try to focus on those that are going to give us more impact in our vaccination coverage. That would be addressing those deficiencies among our vulnerable population. And we consider those areas with low coverage as already vulnerable because we know that they have low immunity already. So we're going to do more granular strategy so that we can be able to reach as much of these people who have not been vaccinated yet.
And in terms naman, Yusek, of booster shots, ano po ang sitwasyon ngayon?
We are really having a challenge with these booster shots. Right now, we only have covered about 26% among all those eligible for booster shots. This is about almost 15 million, and we are still looking at about 41 million eligible individuals who have not taken their boosters. So we are going to propose to the incoming administration that first, if we can redefine the definition of fully vaccinated to include booster shot, the first booster shot, so that we can get more uptake. Second would be is to really drill down among the different communities and try to see what really would be the issues why they are not getting their booster shots. Hopefully, now that we are having these higher cases in our country, that our people would be more encouraged to receive their booster shots because this will protect them from severe and critical illnesses.
Pero tama po ba yung sinasabi ng iba na kasi baka daw bumababa na rin yung effect nung first series, yung initial series of vaccination?
Well, that is really the evidence that we have right now, that because of these incoming variants of concern, those that are in the country already, it has affected the immunity that our primary series has given us. That's why we need to have our first booster shots. And it is supported by evidence that if you receive the first booster shot, your immunity would be up to 81% again.
But that's ilan po ba talaga sana yung months lang in between the primary series and the booster shots? And for a lot of people, nagwane na ba talaga yun or natapos na po yung period na yun?
Well, according to the Emergency Use Authority of the Food and Drug Administration for the first booster shots, after 3 months of receiving your second dose or your primary series had been completed, you can already receive your booster shots. But up until now, even those who have received as early as November of this second dose of their vaccines, they have not received yet their first booster shots.
As a last question, Yusek, what are your plans for NVOC? And in terms of, you mentioned already steps on how to improve the vaccination rates, pero ano pa po ba yung mensahe niyo for the public to avail of the primary series or the booster shots?
Well, we just like to remind the public that the government is encouraging everybody to receive what would be most important right now would be our first booster shots. You cannot receive your second booster shots if you did not receive your first booster shots. We have enough evidence to show that our primary series or the first and second doses that we have received have already been affected by the variants of concern that we have in the country and has lowered your immunity against severe and critical infections of COVID-19. That's why the government really is doing all of our efforts, doing our best efforts so that everybody can receive the first booster shot. This is the only way for us to up our immunity again here in the country so that we can prevent further transmission of the virus, and also we can prevent more severe and critical cases in the country.
Sorry, Yusek, I just remembered one point you mentioned earlier, to redefine fully vaccinated as those with booster shots. But isn't that going to isolate a big part of the population?
Well, that is the plan. But we need to have this parallel effort that we will be able to encourage more of our citizens so that at the same time that we do this redefinition, there would be more of those who have received their first booster shots, and therefore will not be able to discriminate or as you said, set aside them, especially when we try to link this with the restrictions in our country. It will be up to the next administration to decide, but we think that this is the direction to go so that we can be able to encourage more to receive their first booster shots.
Thank you very much, Health Spokesperson and incoming NVOC Incident Manager Maria Rosario Vergeire.